Hello, my name is Celeste Vaughn-Briggs. I'm an oncology social worker at the Sidney Kimmel Cancer Center at Jefferson and program manager of Jefferson's breast and cervical cancer screening program. Thank you so much to Susan G. Komen for inviting me to present on this very important topic, navigating cancer care through the pandemic. So let's get started. So we have some objectives today. We're going to be looking at the pandemic impact on patients with metastatic breast cancer, the impact of the pandemic generally on healthcare, and what are some specific concerns for patients who have metastatic breast cancer, and finally, some resources and support. Well, the COVID-19 pandemic. Let's kind of backtrack through history. Sometimes it can seem that this information is, we forgot how it all started, but the pandemic was originally identified as a localized outbreak in January 2020. However, between January 2020 and March 2020, the World Health Organization declared a global pandemic outbreak, citing a 13-fold increase in the number of countries with cases outside the original area, and then cases tripling in number. In the United States, an official federal national health emergency was declared on March 13th in 2020. What that did was allow federal, state, and local agencies to take public health measures about mitigating the transmission of the virus and potential impact for all of us, including health systems. What that meant for patients, and we'll get to that in a second, is that immediately, if you were receiving care for your cancer, everything changed. How you were able to access services for those who needed services, needed screening or diagnostic, that impacted that as well. But that started, the clock really started as March 2020. But let's look where we are today. To date, in the United States, there have been over 44 million cases and over 700,000 people dying with causes attributable to COVID. However, several leading epidemiologists do suspect that number is significantly higher. That is sometimes categorized in what they call excess deaths, quote unquote. It's a public health term utilized for the number of deaths from all causes during a crisis above and beyond what we have expected to see under normal conditions. That would mean that people who may not have COVID-19 as a attributable cause on their death certificate, but may have had a prior infection, were immunocompromised, and later developed a complication from COVID that was not necessarily contributed to COVID, but would be considered in that excess death number. And that is a concern for particularly patients and families and communities that are immunocompromised, which include our cancer patients. So what happened to healthcare? Healthcare was severely disrupted for a few different reasons. So what the approach was, because this is a virus that transmits through the air, we went into quarantine, meaning that outpatient services were impacted, inpatient services, voluntary surgery. This was supposed to be designed to limit the contact of early days with the hope that that would kind of break the chain of transmission. And for those systems that had a higher number of patients, allow them to be able to not be overwhelmed in terms of services. Health systems had to figure out, though, for people who still needed treatment, which is our patients who are in active treatment for cancer, heart disease, stroke, heart attacks, whatever the health emergency was, whether it was an acute condition or a chronic condition, how to continue to serve them. But staff was reallocated. There were strict isolation precautions. And, patients lost kind of their support system. So I know for our metastatic breast cancer patients, they may have had a trusted friend who always came with them to treatment to help pass the time, to help them navigate, to keep them company, to be a second ear in terms of advocacy. And due to restrictions, they were unable to be able to accompany those patients, which really, left a hole. And it was very impactful for patients. So that certainly is not something exclusive to our metastatic community, but it is kind of, I think, broad to a whole range of persons who needed that support and welcome that support of having someone come with them or participate in their care. So that was one of the early consequences of the limitations of numbers of persons on site. This is just a graphic that I hope works, which just shows and illustrates how the spread over time of COVID and the numbers of cases, how that changed over the course of the pandemic. So what that also meant is that sometimes individuals in one area of the country may face more restrictions than other areas of the country. People in urban areas versus rural areas. What are existing concerns and barriers for people accessing treatment? That shifted over time. And certainly it was important because some of these systems would try to get additional workers to help with the load. Sometimes systems would have restrictions loosened for a while and patients kind of getting into a normalcy of back to their treatment and having their support persons. And then, there's a surge in that area. And then that was kind of the restrictions were reimposed. And that, again, that disruption, that unpredictability was very, very impactful for a lot of people and worrying. And as you're seeing in this graphic, the spread eased and waned and eased and waned, and we're still going through that. I think cancer patients in particular, in many ways, already deal with a level of unpredictability and how to manage uncertainty in a way that sometimes others who had not had an experience with an acute or chronic illness may be that familiar with. So certainly there are tools and resources, strengths and abilities that patients bring to the table that can help other people who were new to dealing with this type of uncertainty. But I think that it still was a strain, even with all of the experience and strengths that patients brought. I want to spend a little time talking about some other unintended consequences of the pandemic, not just on patients in current treatment, but implications for people yet to be diagnosed and what that meant in terms of screening and diagnosis. So this is from the American Cancer Society. And the potential, they did a study on the potential impact of the pandemic on future cancer outcomes. And I just kind of want to highlight a few things that are concerning. And I know the American Cancer Society and others are working to try to mitigate this, and researchers and healthcare providers, but they're worried. So the COVID pandemic started with kind of reduced access to care for people in current treatment, as well as those who may have missed regular screening. Again, that reallocation of healthcare resources, increased instability in terms of finances due to job loss and unemployment, and that shutdowns and social distancing And quarantines impacted the kind of social support networks that people have, which sometimes help people get to care. That has an impact on prevention and early detection with delayed visits, annual screenings being delayed, abnormal follow-up testing being delayed, and following up on symptoms, which they're worried will lead to later stage diagnosis, which means more complex care many times, and sometimes folks where they have lost the potential to have their disease treated at an earlier stage, and now having that later stage diagnosis, which can lead to more complex, costly, psychologically, emotionally, and physically, as well as financially, in terms of cancer treatment. And again, in many areas of the country with that graphic, there were people who may have been in a phase of their treatment where they were waiting for their surgery, mastectomies or lumpectomies or reconstruction that was canceled or delayed, which has implications in terms of healing, et cetera. In some areas of the country, there were modifications made to treatment protocols, which may have been less than ideal, which they're worried and are studying to see, will that have any impact on long-term cancer mortality? So it's something we're all looking at. This is an article in ASCO, the American Society of Clinical Oncologists, and they looked at a systematic review of what were some of the delays and disruptions in cancer healthcare during COVID. And they found globally, now this is a global review, that 38 different categories existed of disruption. Everything from the impact on treatment to diagnosis, again, inpatient and outpatient services, cancer surgeries, delays in radiation treatment, canceling of chemotherapy. And the impacts of that, again, are long-term. We don't fully know and are worrying and concerning, particularly as the pandemic continues to have ebbs and flows, which impact health systems in different parts of the country. The National Cancer Institute, additionally, right now has a cancer patient study with 2,000 people who are undergoing cancer treatment, who have also been infected with COVID, who are going to be followed for up to 2 years to see kind of the intersection between what does it mean to be a cancer patient in active treatment and have COVID, and what impacts that has on health, what impacts that has on quality of life, and ultimately on cancer mortality. The American Cancer Society has, many of you may already know, they have a long-term prevention study called CPS3, which when enrolled is a longitudinal study, kind of checks up on enrollees year to year to see kind of generally what's going on with their health, are there any new cancer diagnosis or any other acute or chronic illnesses? And they have now added COVID-19 to their screening protocol. So they're going to kind of look at that cohort as well, which is very important for us to get some baseline data. We're going to be studying this for decades to come. So we all know that cancer care is complex. It's multidisciplinary, meaning you have to see a lot of doctors and lots of different specialties, which already implies a lot of complexity. Some of the great things about the specialization of healthcare is that clinical teams, doctors, nurse practitioners, PAs, and nurses can get additional training and be up to date latest research in their particular area, whether that's medical oncology or radiation oncology or surgery. So they're experts in that. One of the challenges of that is that they can be expert in their area and they need to coordinate that with other colleagues who are experts in other areas, which can sometimes lead to challenges in communication within the healthcare team and communicating that information to you as patients. So that is one of the concerns that the COVID pandemic amplified, because some of the normal ways in which colleagues would coordinate with each other, these multidisciplinary team meetings where people would get in a room together and discuss cases, they were able to pivot. Many of those conferences are now pivoted to Zoom, which in some ways makes it better and more easier. But in the beginning, it might have been a little challenging to get that coordination as seamless as it needed to be. We're definitely getting better with technology, but again, that can lead to some potential fragmentation of care. Sometimes with the complexity of cancer care, generally and specifically with patients who have metastatic breast cancer care, is that differing team members can sometimes offer conflicting next steps, and it can be difficult for patients to figure out what the best approach would be and to sort through all of this healthcare information. So that is where your advocates, your patient navigators, your nurse navigators, your social workers, the people in your support circle can be helpful to you to help you sort through, okay, what are my questions? What do I need to know? What do I need to ask my team members? How can I amplify that I'm confused to them so that they can explain it to me so that I understand better? And that is your right as a patient to expect that your team can explain things to you in a way that you can understand. What are some additional unique concerns for metastatic breast cancer patients? Well, as we know, folks with metastatic cancer, which is considered stage 4, meaning that the cancer has spread outside the original disease area of the breast to distant areas of the body. What that means is that treatment goals and the focus of care shifts. It'll be more chronic, ongoing care. And many times that means with uncertain transition points, or transition points where may have been different for folks who are earlier stage disease, meaning when folks are diagnosed at the beginning of a cancer journey, if they're an early stage diagnosis, stage 0, 1, 2, or 3, the treatment team may say you will undergo, for example, 4 months of chemotherapy, followed by surgery, followed by 6 weeks of radiation therapy, and follow up every 3 months for a year, and then 6 months after that, and then eventually once a year by your treatment team. There may be very definitive endpoints in care, and that changes with metastatic breast cancer. There are transitions of care, but part of the transitions of care involve lots of extra tests, extra scans and blood work and provider treatment, provider visits that really then define what happens next. And that uncertainty is very, very, very difficult. One of the supports that we offer patients are support groups and counseling supports, talking to other patients who have been through a similar cancer journey, so that they can support one another through these uncertain endpoints and change points. And COVID just made that more complex. You're adding uncertainty on top of uncertainty on top of uncertainty. Another challenge that may be more unique to the metastatic community is that the general public, including family and friends, may not be as knowledgeable about what it means to be a metastatic breast cancer patient. Again, some of the very helpful things that have happened in the last 15 years are that there are a lot of treatments for patients, and sometimes treatments that don't require patients coming in as frequently to treatment centers, some things that can be taken at home, more personalized medicine, et cetera. And people are able to work and they're able to go about many of their normal activities day to day, which is very great for the patient in that they're able to um, live, love, play, and be in the moment. But the challenge is that sometimes, at least what I've heard from patients, is that because things look normal, quote unquote, then people around them don't necessarily understand that no, they are still undergoing treatment, that sometimes that treatment has side effects that impacts their activities of daily living. And even though they quote unquote look good, that no, they still have all of these concerns, physical concerns, psychological concerns, emotional concerns, dealing with the uncertainty. So that can be a challenge that is unique to folks with metastatic disease. And our role in the treatment team is to help support folks through that. Some additional barriers that may be presented when folks have a diagnosis of metastatic breast cancer is kind of the emotional or psychological component of grief and loss of future roles, kind of that expectation of seeing yourself far projected in the future where that may not feel as applicable in the moment. There's no right or wrong way to do that. Some people that might be true for, and some people that might not be true for. So there's no one way to do this. The way that you are doing that is the best way you can with the information and resources you have available at the time. So that's what's important. So these are some general concerns. It's not necessarily a checklist. Sometimes additional barriers for metastatic breast cancer patients is that they feel a little disconnected from a peer group of other cancer patients who are early stage, who have those definitive endpoints, who have been told, once you are done X treatment, then you are quote unquote done, you're in remission, you're NED, that no evidence of disease. And that can be, people can feel isolated and apart from that. And it can be difficult to have conversations about that. Sometimes there can be financial barriers. There may be some resources or supports that are only available for folks on one stage of the one age range versus others. People needing to continue to work, people continue to maybe not eligible for kind of a guaranteed income, what we think about with Social Security of being over 65 and having Medicare. So people feeling financial barriers that are tied to their need to continue to have insurance. So that can be an additional concern. Advanced directives and goals of care discussions can be challenging and difficult because of the uncertainty. Again, there are so many treatments and so many people have a lot more options in terms of being able to continue to have a new normal life, meaning they can still work, they can play, they're still going through treatment, they are still connecting with their families and loved ones, but they may have some restrictions versus what they believe they would have maybe if they were early stage disease earlier, and now that they're stage 4. And what else can happen? Unfortunately, there can be areas where healthcare providers have some bias in that there's inequity in the system. So what is the impact of stress, bias, and inequity in healthcare, specific to breast cancer and kind of more generally? So per the American Cancer Society, they have reported that For African Americans, there's a higher cancer burden and can face greater obstacles to cancer prevention, detection, and treatment. And about a third of African American women report experiencing racial discrimination at a healthcare visit. There are also other marginalized groups that report inequity or barriers or disparities in care that kind of cross racial ethnic lines, certainly social economic status. So that can be barriers related to finances, insurance. This often comes up in rural areas, kind of part of that geographic region where people may be lower income, be very distant from their treatment provider, have little excess wiggle room in their financial resources, and that can lead to inequity in the care that they receive or options bias in that healthcare provider visit, things that might not be available to them. Educational level, which is a little bit different than health literacy. So a challenge for all of us is that healthcare providers spend a lot of their life educating themselves about the complexity of medical care and treatments, and they speak a different language, right? So sometimes one of the things that they're not always even aware of is how that different language translates into those of us maybe not knowing what they're talking about. So being having some healthcare literacy barriers, that's not the same thing as educational barriers because it's just a different language. So what's one of the ways that we can kind of deal with that bias and equity to make it more equitable? Ask questions. It's okay to have your provider explain things to you if you don't understand, and to kind of incorporate that in. And that will help them improve and kind of remind them that, yes, they talk to folks every day, all day about it, but that for the person on the other side of that encounter, this is brand new stuff to them. There could be different access to clinical trials based on geographic area or inclusion or exclusion criteria. Certainly folks who speak a different language, sometimes that can be a barrier as well. So how do we deal with this? Again, becoming an effective advocate for yourself, for your loved one, to addressing those concerns, writing down concerns. For some people, writing's not their thing. So our little phone in our pocket has a recording device. You can take notes in your phone. You can maybe record yourself reminding questions to ask your provider when it comes up to you. And then having maybe a support person, even if they physically can't be with you in the room due to COVID restrictions, having them there by phone so that they can write down the answers to those questions. It's a lot to process in visits. Having family members talk through what's going on, and not necessarily telling everybody everything, but maybe having one or two people who are your go people who you feel can be helpful in those situations and helping you navigate. Letting your care team know, the social worker associated with the care team, the nurse navigator, the nurse, help you develop a plan of action to address any concerns or questions that you have. Connecting with outside organizations such as the Susan G. Komen Foundation that may provide assistance in advocating either locally or nationally and getting involved in helping make your voice be heard. Again, just to kind of recap, the COVID-19 pandemic, its impact on cancer patients generally is that we already knew there were some existing gaps in care, but this kind of amplified those gaps in care. And this is even beyond kind of bias and equity, just kind of the fragmentation of the healthcare system, that there's usually huge transportation needs for patients, that we haven't quite figured out the best way to get that accomplished. There are lots of appointments that sometimes happen at odd times of day that are difficult for folks to navigate, and particularly if they have any kind of restrictions in their mobility, such as walking with a cane or a walker or even a wheelchair. that can make coordination of care even more complex. Sometimes there can be a stigma in asking for help. The pandemic did amplify the need for the food insecurity issues, particularly as patients were trying to work and go to treatment prior to the pandemic, and then maybe becoming unemployed, which people who were on the edge found out that they were more food insecure. In a study published, and this is even before the pandemic, but in a study published in August 2019 in the Journal of Cancer Survivorship, revealed that 8% of cancer survivors who participated in the survey experienced food insecurity, with higher rates in some groups, including survivors who were uninsured, young survivors, parents with children at home, and Hispanic and Black survivors. So it was an existing issue that got amplified by the pandemic. Again, care that exists in silos, increases in anxiety, depressions, and other mental health diagnoses that impact treatment, and then shifting risk assessments and calculations impacting healthcare decision making. So those were even additional complexities for cancer patients. So let's talk a little bit about this risk. I like this cartoon, which was actually shared with us by one of the physicians in our team here, and that it feels like a very complex problem to solve. The risk of catching COVID while in active treatment, combined with the impact of public health guidelines, made difficult situations even more challenging for metastatic breast cancer patients. So what do we do with that? We look at, well, how do we get support with where we are right now? So the first thing that can be helpful for some folks is looking at, okay, you've gotten this far. You have skills, strengths, resilience. You have good things in your toolbox. So what are those things? Are you a good communicator? Do you write down questions ahead of time and make sure you get them answered? Are you an effective advocate for yourself? How have you gotten through difficult times in the past? Is it through humor? Is it through connection to family and loved ones? Is it rallying support from the community? So you have things in your toolbox. So think about what those things are and use them. Looking at what your external support networks look like. Who in your family and friends can be helpful to you? Now, sometimes this can be a little challenging. And I've had many a survivor tell me that sometimes the people who they thought that would be in their family or friend network isn't who that turned out to be. But they usually can find someone. If your circumstance is that you don't have anybody in your friend or family network that you feel really can be supportive in this journey through you, please reach out to your treatment team at the institution where you're being treated. Please reach out to community-based support groups like Komen or other breast cancer organizations or the American Cancer Society, or people in your community that can help you get through this time. There are even more formalized psychiatric or supportive counseling resources that can help you to kind of more purposefully carve out time to think about what are the lessons you've learned from facing adversity in the past and kind of honing those skills. Sometimes it's not as clear, but with the help of a psychiatrist or a supportive counselor or therapy, you may be able to identify those things, and that can be a support for you as well. Being open to complementary medicine. There are lots of different things that can be helpful in terms of whether that's like a mindfulness-based meditation practice, a yoga practice. For some organizations and institutions, they actually have whole treatment centers that can be adjunctive therapies that folks find useful and helpful in their journey to getting support that they need. So think about those things. Getting support may mean settling into a new normal. That normal isn't what it used to be prior to your diagnosis. that your needs can and do change, but that you can ask for help from others, right? You may need help shorter term or longer term, that may vary, but that it's okay to ask for help. Sometimes for many of the patients I work with who have been kind of like pillars in their community and have been the caregiver, usually giving care to others, sometimes it can feel a little disconcerting to be on the other end of that dynamic. So think about, okay, are there specific tasks that you are okay with asking for help with? So, you know, you like your own cooking. Well, can somebody be your sous chef? Can they prepare the things or go to the market for you with a specific list for you, and then you can do the rest. If you like your clothes put away a certain way, well, can they at least carry the basket of laundry up and down the steps for you so that you don't have to spend your energy and time and resources doing that? So sometimes that can feel a little bit more comfortable and manageable for folks. And when people are able to do those things, accept them. The people that care about you, they want to help you. They might not know how. They may not know specifically what to do. They may give a generalized offer of support, but not know how to actualize on that. And you on the other end might not know what to ask for, but sometimes thinking about a list of, well, what would you be willing to accept can be useful. Making sure you're keeping your treatment team aware of any physical or emotional changes as you're going through treatments, so that there's nothing too small to let them know about. That we're here for you. We're supposed to address those concerns. We may not know the answer, but we're going to try to find an answer or get you connected to someone who can. Try to talk to your family, friends, and treatment teams about any kind of daily routines that are changing, kind of what your preferences are in terms of working. That may be talking through what are the requirements from your HR department in terms of FMLA, or what are the skills that they feel that you're up to doing, and kind of what does your treatment team think about that. So keeping in conversation. And then remember, it's okay to ask for assistance, talking to someone in a buddy program who's been through a similar cancer journey, attending a support group, maybe just an educational program to find out about something that you don't already know about. Your cancer center may have embedded treatment there. Sometimes your insurance provider also offers additional resources and support, which you usually can find on the back of your insurance card. There's usually an 800 number for member services. You can start there if you want kind of a different perspective. And again, community support groups like Homan and other entities can help you. And this is a great resource list. It's by no means exclusive. There may be things that are more specific and local to you that may be helpful and useful. I do want to highlight that there are some crisis hotlines. If you are feeling overwhelmed, certainly let your treatment team know, but there are the National Suicide Prevention Lifeline. There's a crisis text line that you can text with someone if you're feeling in extreme psychosocial distress. And so please reach out for those resources. And then there can be different organizations that can help you find a provider that may be more aligned with your identity or needs. So please look at those resources and ask your treatment team. Again, these are by no means exclusive if you need something else more specific. There are some applications even that can be useful to help you remain centered. The Calm app, Headspace, Mindfulness, Stop, Breathe, and Think, the Calm Anxiety and Stress. So these aren't therapy by any means, but they can be useful breaks in your day to help you deal with emotional distress. And in navigating treatment as a metastatic breast cancer patient, just start where you are, use what you have, and do what you can, which is a quote from Arthur Ashe. I want to thank you for your time and attention today. Please be well.